1. Hello, everyone. This is Jason Grady with Becker's Healthcare. Thank you for joining us for today's webinar, Balancing Burnout, Demand, and Access, Insights from 4 Leaders. Before we begin, I'll walk through a few quick housekeeping instructions. We will begin today's webinar with a discussion, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's session to access the recording. If at any time you have issues with your audio or visual, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to introduce River Meisinger, VP of Enterprise Solutions at AMN Healthcare. River specializes in workforce strategy, partnerships, and system transformation. He is known for driving innovative approaches to workforce planning that strengthen operations and enhance patient-centered care. River, thanks so much for being here. I'll now turn the floor over to you.
Awesome. Thank you, Jason. Really excited to be here with such an amazing group of leaders, and definitely want to make sure as we kick things off and go through introductions, each of them have a chance to tell you a little bit about themselves and the story of the work that they're doing today. So we'll start with Danielle, and I'll turn it over to you.
Great. Thank you so much, River. My name's Danielle Gable. I am the Chief Executive Officer for Ventura County Medical Center and Santa Paula Hospital. We are a safety net public hospital in Ventura County, just north of Los Angeles. And I have been in this role for about 4 weeks. Prior to that, I was the Chief Nurse Executive for the same organization. I'm happy to be here.
Awesome. Thank you, Danielle. Chris, do you want to go next?
Sure. Hello, everybody. I'm Chris Gaw. I'm the Chief Operating Officer at Denver Health. I have been here in this organization about 6.5 years. And before that, I was at Valleywise Health in Maricopa County, Parkland Health in Dallas, and then Renown Health in the Reno, Tahoe area, all of those affiliated with Safety Net, or that designation of Safety Net Health Systems. And so collectively, next year will be 40 years in healthcare, and it's been a great journey.
What an incredible career. Thank you, Chris, for being here. Alan, do you want to go next?
Yeah, thank you, River. I'm Alan Gurley. I'm the Interim Chief Nurse Executive at San Juan Regional Medical Center. San Juan covers the Four Corners region of New Mexico, Arizona, Colorado, and Utah, a very, very rural region of the nation. Prior to that, I was the Chief Executive at the Alaska Native Medical Center in Anchorage, covering all of the entire state of Alaska. And then I, too, spent quite a bit of my time in a true safety net at Harris Health in Houston, Texas, as a chief executive of the hospital there for 5 years at Lyndon B. Johnson Hospital. So also about 40 years in healthcare, and it has been a rather remarkable journey, and I am glad to be here to help today.
Thank you, Alan. We'll round things out here with Andrew.
River, thank you very much. It's a great honor to be here today. I'm Andrew Gofrak. I'm the Chief Executive Officer for Arrowhead Regional Medical Center, which is the county-owned hospital for San Bernardino County in California. We are a large 456-bed university-affiliated medical center, regional trauma center, regional burn center, and cover the entire county of 20,000 square miles and 2.2 million residents of San Bernardino County. It's a true honor to be here. I've been in healthcare leadership for a little over 2 decades, spanning my career throughout the country, and working in the safety net environment and working in the public environment is a true honor. So thank you for having us here.
Awesome. Thank you all. What an incredible group as we're going through today. Obviously, we're excited to take questions from the audience as well, but kicking things off and maybe question number 1, Chris, to get us started here. As we think of workforce expectations today, looking at care delivery models and community needs as they continue to evolve, what innovative, maybe non-traditional approaches have you implemented to strengthen both your workforce sustainability and build on the resilient pipeline, right, and looking into the future of both today and where healthcare is headed with Denver Health?
Sure. Thanks, River. So really a lot of tactics, right? So if we start with pulling outside of the organization, what are the partnerships that we have, whether that's through recruitment agencies, through colleges and universities. We are a teaching health system as well. So we certainly have academic relationships, but what we've learned, and certainly through COVID, and there's so many lessons I'm sure all of us will lean into sort of the post-COVID era, is, we can't do this alone. But yet we also, none of us, particularly in safety nets, all of us on this call, we are not plentiful in resources. And so we have to get more innovative and creative in how we establish those relationships. And so I would say feeding that pipeline from the outside in is one approach, but obviously retention is the best way, because you retain those people that you have. It's not only cost effective, but it helps you from a cultural perspective to make sure that the folks on your team are really embedded in your team. So, less travelers, less agency staffing, that kind of approach. And so really doing so much of that culture work in partnership with our HR colleagues that bring that expertise to the table, I think has served us incredibly well. So again, I think it's both an outside and an inside approach to sort of that current dilemma of workforce challenges.
Yeah, I agree with you, Chris. I think one thing that has been helpful to us in a more rural type environment is having really close relationships with all the local schools for all the healthcare specialties that we recruit for. We're located somewhere that's not really a commutable distance from a large metropolitan center, so it's really important that we try to grow our own within the local pipelines. One of the kind of innovative things that we've done here in Ventura County for the nursing students is we have a regional planning committee for all the nursing clinical placements with all the different hospitals in the county. So all of the deans of all of the schools in the county and all of the chief nurse executives meet once a quarter, review opportunities that we all have. Anything from sharing feedback about, maybe gaps in learning from some of the nursing students to areas where, we're not meeting the school's need for enough hours. So most recently that's been in more pediatric type settings, but we have a really nice, two-way conversation about how we can improve access for the local students into our programs. And we found that to be really helpful. And in fact, we draw probably about 90% last I checked of our new hires from the local schools. They're all local, local folks. And we're very proud of that because as a safety net institution, they have a commitment to the community, both, as an employee, but also as a community member. So it builds a really nice culture and some great engagement.
River, one of the most interesting things that the schools provide for us is an opportunity to see who they are recruiting into their programs. And so what we've found in Farmington in particular is that we need to go a step back further than the local nursing schools. So we are now getting into the junior year in high school. And as the schools are producing patient care technicians or nursing assistants, we're reaching out to them, having that dialogue once they turn 18, giving them access to the hospital for clinicals and giving them access to the hospital and hiring them. We just hired our first 5 students who graduate from high school quite literally, and then within a matter of weeks are coming to work at the hospital as patient care technicians. And then what I think the conversation really is appropriate about internally, what do you do then? We need, where we are, we need to look really at our environmental services technicians, and we need to look at our central sterile technicians, and we need to look at the folks that are PCTs and figure out how do we create nurses and radiology technicians and lab technicians out of that cohort, because they've committed to the hospital already. So how do we get them to grow into the next level of opportunity for them? And when you think about it on a more global perspective, oftentimes in our environments, I think this is true of all safety nets, this is our opportunity to take people out of poverty and give them middle class income levels through academic support and educational support to get them into different roles.
And I'll just add on to all the great comments from the other panelists. One of our core strategic values and focus areas is to become the #1 healthcare employer in our region. And we know that we're not always going to be the highest paying employer, especially as a public safety net, right? So that really focuses on culture, that focuses on retention, I think all too often we always use the term recruitment and retention, but I think we have that backwards. And the focus really should be on retention first and then recruit as you grow. And I'm really proud of our teams at Arrowhead. We have, in partnership with a local university, we've actually created several years ago our own school of laboratory medicine and our own school of radiology for radiology technicians. So they come to work at the hospital, they get their degrees, and then more often than not, they end up staying with us. We've also had the privilege of partnering with about 35 different institutions locally for both allied health and nursing professions. And then our nursing team has really taken it up a notch. And, every quarter we have a new nurse grad cohort that we hire into. And we started that really, several years ago, but at one point we were trying to hire 200 to 300 people during these cohorts. Now we're down to 20 to 30 people. But we still get 300 plus applications each time, which is a great testament to our team. And I think the work that our frontline leadership has, our frontline teams, in terms of building that culture, building that collaboration, building that sense of family. We all know on this call that working in a public safety net is not easy. We see some of the sickest of the sick patients. We see some of the most acute, and where other hospitals sometimes say, nope, we're not going to do that. We say, please come and we'll take care of you. Right. And so it's also a great training ground as a result of that. But I think it brings the culture together of those who are working at the bedside even closer together, because they know they're working with less resources, but have such a great mission behind taking care of those underserved and taking care of patients and making sure they have the best quality care regardless of where those individuals come from. So I couldn't be more proud of our team.
Great themes, right? And kind of hearing, right, the importance from each of you, not only of the communities, right, the culture, the environments you're serving, the importance of retaining, building local, right, keeping healthcare in your community, obviously resilience, right, among each of you in different locations that come out in themes here. Chris, just maybe one question for you as you kind of think of doing more with less, right, or maybe doing more with more, depending on how you look at that. I know you all are doing some specific work with lean methodology and what that looks like, and maybe even teaching some of that. I'm curious for you, what does that look like? And if you want to share a little bit more on what that's looked like across all your teams.
Sure. So having gotten my lean certification, I'll just say 20 plus years ago, I got I drank that Kool-Aid earlier in my career. And I've really, personally made decisions not to go anywhere that didn't have such a philosophy or did not at least believe in trying to build it. And so I'm blessed here at Denver Health. We have our Lean Academy. It is nationally recognized. And what I take pride in that work is not only do we do the work inside the walls, because again, everybody on this call knows that, in a safety net, you tend to make that dollar go really far. And so really you could do that much more efficiently with lean methodologies and lean practices. And so we do that inside the walls for our 8,700, 8,800 employees, have that offering to them. But we also package it to where we can pay that forward and sell it at a much more reduced cost for organizations that just don't have an ability to build such an infrastructure. And so we do that as a pay it forward service. And it really brings people to a Gemba or to a work environment where they can learn real practical application of that in a health system environment. And so it's priceless for us to be able to do that for our teams. It also has an effect on employee engagement. So when every one of us has talked about retention, that is an investment we make in the staff, but ultimately they're making that investment back into our community, into our patients, into collegial relationships, and really producing those operational efficiencies that all of us have to rely on because we don't have those big bank accounts. And so how do you do more with less, or maybe sometimes more with more?
Thank you for sharing. Question number 2, maybe starting with Alan here. When navigating periods of rapid change and constrained resources, building really on that theme there, what leadership decisions today and or in your past have been trade-offs, have been most difficult. And out of those experiences, how has that shaped both resilience, how your teams look at operational agility, and really ultimately going back to that same theme for each of us, right? How is that taking shape for community impact locally and or in the past locally for you?
Yeah, River, that's a really, really great question and a hard one, quite frankly, because at the end of the day, what you end up doing is trading off this notion that we can be all things to all people, and we can't. And so, in Alaska in particular, when you have um, limited access and it's difficult to get places, and half your patients fly in to your community, and you have to run hotels at the same time you are trying to run a hospital system, right? It's a real difficult thing, and then you're sending patients away. So you have to realize that the things that you're going to do, you're going to do extremely well, but you're not going to do certain things that are really important. And so you have to discipline yourself that if I know it's coming and I can't do it, I make it super efficient to get the patient out rapidly. And all that is predicated off of relationships that you build over a long period of time. I think anybody on the call would probably acknowledge that, the two key factors for leadership really are relationships and results. And we can't be successful you don't have relationships or results, you're not going to lead successfully. So it's really important that you did that. So some of the key trade-offs I think were difficult for me in a rural environment is when I have to send away the pediatric patient in particular, or the pediatric behavioral health patient. That's hard because now I've got a child in crisis and a mental crisis, and I don't have anywhere near the resources or ability to care for them. And in the case of Alaska, I was having to send those children sometimes to Washington, sometimes to Idaho, and the families can't get there. And so now you've got this further disruption in a child's life. Or, if it was an autistic child in particular, those resources are not available frequently throughout the country. And so you have to send those away. And it's a difficult thing to then deal with that and figure that part out.
Ah, wow, very good examples, Alan. I think, yes, in a safety net institution, I think, the majority of us probably face those kind of difficult trade-offs every day. I think for me, what's really resonated with me was sometime late last year, as the challenges in funding started to become more evident at the federal level, we had to really look at our rural hospital. So I have a level 2 trauma center, our kind of mothership, and then we have a 49-bed rural hospital. And that rural hospital, it resonated, Ellen, with when you said, do everything for everyone. We tried. The community wanted that. We tried to run an ICU. We tried to run a obstetrics and labor and delivery, and did that for many years, trying to, figure out ways that we could run more efficiently, increase economies of scale, that sort of thing. But we just hit a point where, we recognized we couldn't do it anymore and still keep the hospital afloat. So that was a tough trade-off we had to do last year. We had to make a decision to, send all of our intensive care and laboring patients over to here to Ventura. And obviously that is not a decision that was made lightly or that sits well with any of us, and it's challenging when you have to give messages like that to the community. But you recognize that, you have to kind of step back, take a 30,000-foot view and think what's better for, the region as a whole sometimes. And you have to make really, really difficult decisions. And I'm proud to say that, the staff and the community was very resilient. And while there was a lot of concern, we've been able to, change operations and do more through Ventura County, but with no impact to patient outcomes or safety. So we're very proud of that. But these challenges in a dynamic healthcare environment, especially one under such financial pressure, these types of things are probably going to happen more often than not.
Yeah, I think adding to that, it's really important, to look at your internal operations and really addressing how efficient can you really be. I love, Chris, the fact that you guys have your own lean institute to really make sure that you are driving that efficiency. As safety net hospitals, all too often we become also that backstop in our regions for where other hospitals are making those same decisions. and either closing down services or closing down or reducing services, those patients come to us. And we're often faced with that same question to say, if we don't do that, even if it's not profitable or even if it's a strain, if we're not doing it, then who will? And where are those patients going to go? And we're going to see that more and more, especially as the implementation of HR1 comes into light over the next year, year and a half, 2 years. You're going to start to see more and more consolidation of healthcare delivery locally, and then really the heavier reliance on those public institutions to take over those cares without that funding. So being as efficient as you can, really looking at what you're doing. We've had to make the decision a couple of times, fortunately not on reducing major services, but on not expanding services, right? Where we know that we want to really grow. We know that there's a community need for us to grow. We've got the volume certainly there, but just economically, we're kind of slowing down that expansion because we can't meet that demand or that need from a financial standpoint. But really, we're trying to leverage and lean in on how do we be more efficient? Are there technologies that we could implement and purchase and maybe spend a little bit to save a whole lot more? So that way we're looking at more real-time data decision making, more automated decision processes to help us just be more efficient, so we can operate more with less, and it's going to just continue to be a significant challenge moving forward.
Yeah, and I would just sort of add and tie this together in the sense of, in my 40-year career, I have never felt like more of a moral dilemma than it feels like, even just since 2020, let alone sort of the impacts of HR1. But really having to, and I know this is about workforce, a lot of this is about workforce and resiliency and sort of optimizing our, operational efficiencies. But when you add sort of the moral dilemma of things that are being put upon us, and again, we're all safety nets, so we all have that mission-driven social capital that we lean into when we can't pay as much, but yet we can fill the sort of that mission-driven thing that the folks that come and work in our organizations look for. At the same time that those pressures of moral distress are being put upon our care teams. And I think we are in a time where change management and those skills of change management and how to bring people through that journey is just so critically important, different than in any other time in my career.
River,
Such good thought. Go ahead, Alan.
One last thought, because it got raised. It's the right thing. The providers that we are trying to recruit that are coming into these environments, we're not recruiting the person that wants to make a name for themselves. We're recruiting the person that is so mission driven that they're willing to take that journey with us, whether they're a provider, a doctor, or a nurse practitioner, even CRNAs, in my case, really rural environments. It's really even the nursing staff that you have to be so upfront about that mission that they understand we aren't going to be able to do everything, but we need you here, and you're going to have to be part of that mission with us. And that's been our best recruiting tool, has to really enumerate that mission and really elaborate on it, so people go, yep, I'm going to come there for that, because that mission matters so much. It's been a big part of the workforce recruiting for us.
And Rivers, maybe to tag on a little bit to that, I think one of the hidden costs that we all know about and we all deal with is the cost of either failed recruitment or hiring the wrong person, right? And you put them through orientation, you spend a lot of time, a lot of resources, and then they leave, right, for one reason or another. And so we look at our workforce, it's, really making sure that we're tying into, are we hiring the right person for the mission and not just a warm body because we need to fill a position? I think that comes back and haunts us all if we've hired the wrong person for the wrong role, either in productivity or in, having to re-recruit 6 months, 8 months down the road. And I think as we look to be more efficient, hiring the right people, even though it may take a little bit longer, is definitely a payoff at the end of the day.
I agree. Probably the single most important thing that I've started to look for when I'm hiring people is people's interest in being flexible and learning how to work in other environments. I love it when I'm interviewing someone and they tell me, well, I'm really applying for this role, but I'm also super interested in this, because that tells you right there that you have somebody that potentially will grow within your own institution and pipeline. With nursing, we do that all the time. We actually ask our new grads to identify 3 units that they would consider having their career in and are willing to cross train across, because that way you're getting people, not only are you giving something to them by giving them a more robust skill set, but you're also giving something back to the hospital by making sure you have a deeper bench of people who feel like, we've really made a commitment to them, and then they're more invested in staying.
Yeah, I think I'll build on that with I think it was the Navy SEALs that had the mantra, slow is smooth and smooth is fast, or something like that. And I think it really echoes what Andrew was saying about, do not just put a warm body in the seat, because the wrong body costs you way more, not just in money, because that is evidence. There's proof in that if that turnover is very costly, but it's also, if it's not right fit for them, it's likely not a right fit for the patient. It's not a right fit for the colleagues that they're going to be working with. And it's just, sometimes you have to go slow to actually go fast.
Such good themes from each of you. Before we move on from this question, you all provided great examples around some of these tough decisions, right? Keeping the focus, though, on taking care of the community. Any guidance, tips, themes of how you communicate this, both at an executive level, how to communicate that among the teams to keep continuity, transparency, that each of you would want to recommend?
Yeah, go ahead. I think, Alan, were you going to go? I don't want
No,
to.
go ahead. You're good.
Something that we held on to that we learned during COVID, we have a weekly huddle, and it's a WebEx. About 500 to 600 of our leaders join that call every Tuesday morning at 9 o'clock. We've kept it consistent. We make sure that it's about half and half content and substance, and the other half is sort of a Q&A that people can put in the chat. That has been probably the biggest impact as far as getting messaging out. And then a Denver Health leadership update is shortly comes right after that. And it allows frontline leaders to have at least a weekly huddle sheet of the things that were covered, really from a top down. And then we look for ways that it's sort of bottom up, that we get feedback on what's working and what's not working. I mean, there's lots of examples, but whether that's town halls or leadership forums or, just huddles inside departments. But I would say the key thing that we learned during COVID and held on to was that weekly leadership huddle.
River, we do very similar things. The leadership huddles are really imperative that we have them in town halls. I will tell you that I have had better success probably with focused town halls. I have town halls with the nursing assistants and the PCTs. And that's because that group is so important to the entire hospital. And sometimes because that's considered an entry-level job, they get forgotten about. And so to give them some specific focused attention, and let's do a town hall with just that group, and it's amazing what they know, and it's amazing what they hear, and it's even more amazing about what they share. And so, I really sort of, by hook or by crook, I focus on that group and say, you're the ears to everything here. And since you touch patients in a way most of us don't, they're really great about carrying forth the message for us. And really, they also come from the population that we serve in many cases. So they're carrying the message back out to the community about what's going on with the hospital. It's just been a really strategic, thoughtful thing that, we put our mind to, and it's been really a blessing how well that's worked.
Congratulations. That's fantastic. I think, we've talked a lot about, huddles, town halls. I think those are great ways to get communication across. I think, in the larger institutions, you really have to try every communication channel that's available. So it's in person, it's WebEx, it's email, it's, pop-ups on their computer, you name it. Everybody takes information in differently. We definitely have some standardized sort of newsletters that we put out. We have an infection control newsletter that goes out to the direct care clinicians. We have a wound newsletter that goes out to nursing. So some of those methods work really well too. But piggybacking a little bit about what Alan said, I think using your employees to be the communicators is hugely helpful. We were a little late to the professional governance game in this institution, but we stood up nursing professional governance about a year ago, more or less. And I have found in my time in the last year that staff, it's particularly in the departments that participate, are much better informed than they were before, when all of their leaders and executives were sharing the same messages. There's something about the bottom up communication and having staff relay messages to one another where there's like a shared accountability, and people seem to really do well with it. So I think I guess the point there is using informal channels is sometimes as important, if not more important, than all the stuff that we do as executives.
Yeah, I could not agree more with everything that's being said. And you can't underestimate the power of just rounding informally, being on the floors, talking one-on-one, not even necessarily about their workload or their patients, but just connecting with our team members just on a personal human basis. And you get so much out of those conversations that you pick up on different opportunities to improve the organization. I can't tell you how many stories I've heard from my either frontline nurses or EVS or security, where we've been able to take that feedback, and they were just sharing in just general context, but take that feedback and meet with our leadership team to say, how do we improve this? How do we drive this, right? Sometimes I feel that with more of the formalized events, rounding tools, all of that, you're not going to get a whole lot of authentic, right? You can, and there's great stories of that happening, but people are more on the spot in those scenarios, or maybe a little more uncomfortable to speak with the CEO in those kind of settings. Whereas just walking around 24 hours a day, right? Hospitals are 24/7 operations, and those that work at night have just as much to say, sometimes if not more, than those during the day. And I can't underestimate the importance of just being visible and just engaging on a humanistic level.
Mm-hmm.
Such good points. Obviously, servant leadership, and love the call to Andrew, right? The difference, right? It's not an 8 to 5 business. It's every single day, all day, right? And these teams leading that. This builds probably very naturally, Daniel, maybe starting with you here on our next question. In that same right vein of looking at workforce burnout, thinking about some of the change fatigue, looking at trust, right? We talked a bit about that. How do you go about, obviously talking a little bit in the staff, right, front lines, but building that same trust with those teams, and really specifically those frontline leadership, those individuals that are engaging with those teams. How have you really worked to build that trust and really engagement with those frontline leaders?
Good question. And I think it's one that we're always refining as leaders. For me, I really appreciate what Andrew said. I devote at least 30 minutes of every Monday to Friday to hit the floors. It's my favorite part of the day. No offense to everybody who's in meetings. But my favorite part is getting out there with the staff, and I rotate where I go. And I just sit and listen. And I think to that end, I think Andrew already touched on this, but a lot of times they will say something that is driving them nuts, that is like super low hanging fruit. This fan over here is really loud. And you're like, oh, I can fix that, right? So that's how you start the relationship of trust, right? If somebody tells you I have a problem, you close the loop, you figure out how to fix it, and you circle back with them. Hey, thank you so much, River, for telling me. Here's what I've done. That in and of itself, at least in my career, has been the most successful way to build trust. But I think the other thing too is people trust you more when you're authentic, open, and transparent. And I say that a little tongue in cheek because in safety net public hospitals, we often are working in a little bit of a challenging environment between the politics and the practice, where we sometimes have to withhold information that some of us may feel more comfortable sharing. But when I say transparent, what I really mean is say as much as you can about what's going on. And if you can't say it because it's a political issue or whatever, you tell them, I can't say it and I'm sorry, but here's why. And here's what I can tell you. People need to understand that what comes out of your mouth is valuable, authentic information, and you're trying to keep them informed. That I think is the other piece that really builds a lot of trust. We try to spend a lot of time, like in our morning huddles when we're sharing messages. One of the things that we try to do is instead of just like spitting out information to leaders and then just telling them like go forth and tell all your people the same thing we just said, we really spend a lot of time doing like teach back. So like, River, tell me what you heard from this memo we just read. How do you think is you would go forward and present that to the staff? And it becomes more of a dialogue and people really get to kind of interpret and intake the information so they can put it out in a way that feels more genuine and authentic and not so robotic.
And just to add, I think to that, one of the things that we changed a couple of years ago was our town halls. So multiple times a year we have town halls, and we used to do what probably the more traditional where leadership would present this is what we're doing across the different streams of the organization, and then leave about 5 to 10 minutes left for question and answers, right? But what that's really doing is telling your staff you're not interested in the question and answers because you're not giving them the time. Right. So we transitioned that 2 years ago to now the entire town hall is Q&A. There's no formal agenda. There's no formal questions. There's no there are boundaries, right? We tell them right from the beginning we're not going to talk about HR related items. We're not going to talk about patient specific items. And there are certain things that are confidential in nature. Danielle kind of attributed to a little bit of that that we're going to stay clear from. But outside of those three items, it's fair game, including, what do you like to do after, to when you're outside of work, right? Just to make it, a little more fun. And that's allowed us really to open up in just true dialogue with what matters most to our team members. To make sure that we're getting the information out still. Every month we do a 3 to 5 minute, news video, so to speak, where we'll share a video that we put on through our intranet and email to all of our employees. I said, this is what we've been focusing on for the last month, or this is what we want everyone to be focusing on in the next month, right? So we're still getting that information out, but we're taking the valuable time that they're giving us during these town halls and not just sharing and not really listening, but really just listening and answering questions that are important to them. And then we'll take notes of all the Q&As because we do about 15 town halls in each session that we do. And we'll post those all on our intranet. So that way everyone has that ability to listen to what was that question from a different town hall that maybe they didn't have an opportunity, right? And then we take that and put that into our stoplight reports to hold ourselves honest, where we say, this is what we're going to do. Let's follow up and make sure we're doing, because authenticity and really following up is critical to trust.
And I would just add on to that. It brings to mind, I think it was Teddy Roosevelt that said, people don't care how much you know until they know how much you care. And I think that, everybody's touched on this, right? It's meet people where they are, if it's, that a unit just had a bad trauma, or, they just, did an honor walk, or whatever the scenario is, go be present with them. Make sure that they know that, you're not sitting in an ivory tower somewhere. First of all, safety nets don't have ivory towers, just for the record. But that you really do understand what they're being faced with. I think that, there's all the little nuggets I'm sure we've all learned along the way. One that sticks with me is the same letters in listen or in silent. And I think that, that always stuck with me of like, if you really do want to hear, you have to not be the biggest voice in the room. Sometimes you need to just, be present and let people talk to you. So I think, just grabbing onto those nuggets that really help you connect with people. And I think lastly, the most important thing, in a change management world is do your processes so people know and feel that you're doing it with them and not to them. I think that is just a very different way things land. They'll go on that journey with you, but if it's a different approach, it's going to be a lot harder.
Man, this is a great learning session. I need to talk to you guys outside of here. It's really good. I would say, River, I've done a lot of culture change in my career because I spent most of my time helping organizations who are having a struggle. And when I usually arrive, what I find is that the frontline managers don't want to talk and they're unwilling because of how they've been trained or raised. And so we really start off with the safety huddle and having an extraordinarily transparent discussion around safety events every day. And then we dialogue about that. But what I've learned is if I can get people to talk honestly about anything, it's safety. And so we take that safety events and we do the routine sort of things that every administrator does. How's the patient? Now let's talk about how the nursing staff is, because it's traumatic for the nursing staff to be involved in an event. It's traumatic for the medical staff to be involved in an event. And so through the safety huddles, we create the beginnings of this trust that is around patient safety and everybody can agree to it. There's no politics in it. It's safety huddle. It's patient safety. Let's talk about that. And so we focus on safety and emotional safety there. And that helps us when we're starting to change a culture. And then the next thing we do as a tactic, and I like it a lot, is to do skip level meetings. And so I'll jump right over the vice president. I'll jump right over the directors and I'll have one-on-one sessions with the managers to find out how they're doing and to get to know them a little bit better on a more personal basis. As God said earlier, what do you do when you're outside of work? That matters. And what I find is as soon as I create any level of commonality, well, I've got kids and my kids love baseball, or I've got a child in the 82nd Airborne, or, I've got a kid who's a sheriff. I've got any of those things. Now we talk about that. And that's the first bit of dialogue that I have. And then we get into all the other stuff. And it just sort of opens up the willingness for everybody to be authentic and honest. And then when you're walking around, because I've never met a successful leader who stayed in their office, that doesn't exist. We get to have these real great conversations, but that's how we've done it. And obviously a bunch of experienced people on this call who really understand that.
Yeah. And I think, if I can just piggyback off something you said when you were talking about making sure that the staff is fine as a result of events. One thing that we recently stood up in my organization last year that I now don't know how I ever survived in organizations that didn't do it was a peer support program. So we have a formal program now. You used to, when there was a traumatic event or something, of course, like Chris said, the best leaders go and be with the staff. But sometimes staff want a peer. And they don't feel comfortable, when one of us comes or whatever. So what we have done is, as part of our peer support program, we actually enlisted peer supporters from every potential role and level in the organization, from high executive all the way down. There are people who have been formally trained to meet with their colleagues to help that hear and be with them when they have a hard time. And I thought, gosh, a lot of us in healthcare are not so good about taking care of ourselves. We're really good about taking care about other people. And I thought, gosh, I don't know if this program is going to be successful, because I think people aren't going to want to do it. They're not going to feel comfortable. And shame on me. I have been shocked to see how successful that program is. It took about maybe a month before people started asking for it. And now it's like an expectation. Now something that you would have never thought necessarily would have risen to the level of peer support, the staff ask for it. And it's been a huge, huge satisfier. And I think it really makes employees feel like they're taken care of.
I would agree. We have a similar program, Danielle, and it is, I think we've tracked since COVID, or it came in place sort of shortly after that. Ours is called Restore, and it's a zone on the main campus, and then you sort of we have a mobile unit that goes out, and I think we're approaching 400,000 visits to that Restore unit. So, wow. and it's confidential, but they track just sort of more major statistics in an aggregate level. And I mean, all the way to preventing suicide, yep. To, just the day-to-day, I just wanted to go get a cup of coffee and talk to somebody. So, I would echo that has been a game changer.
Chris, you mentioned you have a mobile restore clinic. Can that come all the way to California as well?
We'll talk after.
Sounds great.
Such good thoughts. Love the continued focus, right, on taking care of your teams, really taking care of your patients, right, but also at the same time being visible and just such an importance, right, and listening to each of you to over communicate, take the time, listen, follow up. In a world, right, I think themes have been pulled in this entire conversation. We think about HR1. We think about the importance, right, of the safety nets you're serving, having to do more with less or more with more, right? And all of the free time you have and thinking about some of the mixes that come in with partnership. What does that mean? Andrew, maybe starting with you, we think about some of the pieces right today and looking at how organizations will look at AI, how organizations will think through workforce technologies. How do you evaluate a strategic partnership with all of these ongoing challenges? For each of you, right, as we start with you, Andrew, what in your lens, right, mind really differentiates an actual workforce partner in that space versus transactional? And how do you continue to determine whether that partner is really aligned both genuinely to your mission, your teams, and also making sure, right, you continue to create long-term success versus those partners that may be more transactional in nature in and as you're evaluating nationally?
It's a great question. We've got a lot of different partners or organizations that we partner with or contract with for workforce solutions, whether it even be some of the schools and pipelines or more of those traditional registry or temporary help or interim placement positions. I've always said, and I think we could all agree that when you've seen one hospital, you've seen one hospital, right? We all have our own nuances. We all may have a similar mission or similar direction or true north, but the fabric of that organization is going to be different, right? Wherever you are. And when I'm looking at partners in our workforce solutions, it's yes, leveraging technology to help us prioritize what positions are either going to be harder to fill or what are those trends going to look like, or given my workforce today, where are those vulnerabilities in the next several years, to look at where do we need to start recruiting now, or is recruitment challenges different today than they will be in the next couple of years, and getting ahead of that to some degree. But really where I see that partnership is that workforce solution company to spend the time with our team, spend the time with the leadership, walk the floors, invest in us in order for us to invest in you. The more that you know what we are looking for, the more you know about our teams, the more you know about our challenges and also those successes and what we're really proud of, right? We don't look at temporary staff or registry staff or whatever you term it any differently than we look at our frontline, our full-time staff, right? When they're on the floor, they're on the floor. And the expectations are the same. The culture should be the same. So really when we're evaluating partners, who really wants to be a partner versus who is kind of checking the box to have that transaction and just place somebody and not worry about what that outcome looks like.
And I think, one thing that I really appreciate is, in a workforce partner is to tell me, hey, I think that you are spending too much time, effort, and money in this area. And here's what I've seen other organizations do. Maybe you should, move your resources from area A to area B. And I think that honesty, transparency is also really, really appreciated, because sometimes we don't know. And, the vendors, they see 10 times as many different practice models and organizations and cultures as we do. So I think it's very helpful to us to hear what other places are doing, and to, come up with creative solutions and partner with you to brainstorm different ways we may not already be doing to meet our workforce needs.
Yeah, for me, having been in this almost 40 years and Safety nets, I think, for us, we've been around 165 years. I think all the safety nets I've been in, it's 150-ish years. And so I want a partner that's going to be there for us in the good times and the bad times, right? If you only reached out to me on LinkedIn because you saw that we got a bond passed,
Yeah.
I'm not sure that we're probably a fit for each other.
Yeah.
But if you've been there, through a storm and you helped us through that, and in those good times, we're going to come up with solutions together. And I think it was Danielle who said it, organizations out there that do this work, whether it's workforce or operational efficiency or whatever, we're a pretty small network in the sense of not only healthcare, but then when you think of the people in safety net, we know who does things well and who does them maybe not in that same way. And so I think word of mouth, it's so important. So, for me, when I go to look at a vendor, I reach out, like, give me your list of references. I want to talk to folks. I want to know what their experience was with you, because we are literally operating on no margins. And so that dollar we're going to spend may be our very last dollar to get us an efficiency that we can, write another check tomorrow. And so there is no room for waste. And so I think, making sure that we are engaging with vendors who do what they say they're going to do and that they produce the results. Again, it takes two. But to me, those are kind of the measures of success that we look for.
We may have you on mute, Alan.
Sorry about that. I couldn't agree more. I think everybody really hit on key points. One of the most important things for us, because if you've seen one hospital, is that I need to work with a workforce vendor who brings more than one option to the table. Because, every hole is not square, right? And I've got somebody I need to have a relationship with somebody who understands my unique situation and can bring to the table a combination of things to really help me see the other side of the problem that I'm on today, right? My current challenge, get me to the other side. And it varies. It is not one size fits all and never is. And so I need that help. I would talk about what Chris said. I will never forget the vendor that called me in the middle of Hurricane Harvey while I am inside this hospital surrounded by 6 feet of water for 5 days. And the vendor that called me and said, "Hey, Alan, I'm just checking on you. Want to make sure you're okay. Tell me what you need and call me when you're all done." And that was like, wait a minute, you're a vendor? And you just called to check on me personally and said, call me when you're finished? Oh my goodness. And when I did call, it was, I don't want to talk about business. How's your staff? How you guys feeling? Do we need to bring anything to you? What do you think you need? We want to help. And so it's that relationship. It's all about the relationships. And can I trust you to be authentic? And, I don't always need it to be about you putting your hand in my back pocket. I need it to be about us having a relationship, because for me to be successful, I need you to be helpful.
Such good themes. I maybe just summarizing, right, listening, right, the importance, right, of trust, right, thinking about partnership, right, matters. That means partnership goes both ways, and dollars matter, right, at the end of the day. I know as we're coming to the end here, we definitely want to look for Q&A from the audience, and we'll definitely lean. I think Jason is keeping track for us from a standpoint of questions that might be coming in and covering those.
River, thank you so much. Thank you, Danielle. Thank you, Chris. Thank you, Alan. Thank you, Andrew, for a wonderful discussion. We do have some time here for some Q&A that's come in from our audience members. Folks, please feel free to submit any additional questions into that Q&A box you have on your screen. But let's get started here with our first question. Danielle, this one's pointed at you. As a first-time CEO, what have been some of the most important lessons you've learned through the growth and evolution of your organization? Looking back, what advice would you offer to other emerging leaders and executives who are preparing for increased responsibility and leadership opportunities?
Well, thank you. Very good question, and one that I've thought about a lot lately. I think I touched on some of this in my comments earlier, but for me, The most important reminder every day is that at the end of the day, we're here for the patients and we're here for the people. We are 1000% in the relationship business. And it's super important, no matter what your role is, whether, you're a frontline manager or a C-suite executive, that you always have a people first mentality. I think for me, the relationship building and making sure that people are feeling heard, and that their needs are being met is the most important thing, and has been critically important to my success and to why, I've been blessed to have progressive leadership opportunities. I think for emerging leaders, really focusing on getting to know um, the people in your organization from frontline all the way up to C-suite, super important, to the theme of being in the relationship business. I also touched earlier on authenticity. I think being your genuine, real self and meeting people where they're at, are some themes we've also discussed that I think contribute a lot to leadership success. I think actually it was Alan who said it's relationships and results, and that is a true story. And relationships first, always. And that's been really, really helpful for me. And then I think the other thing I would say is, you can spend a lot of money on an executive coach, but you could also just find a mentor or mentors. I've been very lucky and blessed in my career to have been impacted really positively by a lot of wonderful mentors, and colleagues. And I think, it's really important as a leader, especially as an emerging leader, when you're trying to learn a new role, that someone's keeping you honest and helping you grow and helping you recognize what you do well and where your blind spots are. That's really important too.
Wonderful. Thank you so much for sharing those insights, Danielle, with the emerging leaders we've got tuning in with us here. Our next question we got was, how are you creating a more unified workforce across internal teams and agency staff, especially when it comes to communication, trust, and building a pathway to long-term retention?
I think we touched upon it a little bit throughout the conversation. Really, it's engaging dialogue across multiple platforms. We are in a multi-generational workforce, right? And what works for one area or one generation may not work for another. And as leaders, recognizing that and having different platforms, different modalities, different ways to communicate. I don't think there's a sense that you could communicate enough, right? To really align the workforce and internal teams. As I mentioned, when we look at our staffing, whether they are full-time employees, part-time, per diem, or temporary help, we're all one team with one mission, at the end of the day. And our expectation is everyone is aligned in how we're driving our strategy.
I want to chime in there. Andrew's dead on target. There's a lot of ways to communicate, but you're communicating one set of expectations. And it doesn't matter if you're a traveler, you're an international nurse, you're a PRN, you're whatever you are, our expectations for exceptional are the same. And that doesn't change whether you're a housekeeper or you're a neurosurgeon. Mediocrity is just not okay. We're going to be exceptional. And since you get to make a choice about how you perform today, you need to make the choice to perform at a really high level, because that's what the organization's about. And we set that standard from day one for everybody. Andrew's dead on target.
We've got time for probably one more question here. The next one we had come in was, many clinicians who trained during the COVID era developed strong clinical skills, but had fewer opportunities for in-person patient interaction. As patient expectations continue to rise, how is your organization helping clinicians strengthen communication, empathy, and relationship building skills while ensuring an exceptional patient experience and maintaining high quality care?
That's a great question. I think we do something pretty cool, for our new medicine residents and our new nurse residents, and some of the soft skill training. Like many places, we have a simulation lab, but one thing that we've done new in the last year or so was invested in a virtual reality program with the goggles and the whole thing. And the program is really, really, it's very robust, but it basically puts the person in a scenario where they are going to be required to communicate in a very challenging environment. Either the patient is angry, or you're the provider and you're sharing not good news with the patient, and it's role-based, kind of role playing in a really realistic scenario where it's a safe space and you're being monitored, and you go through the exercise with the virtual reality program. And then, like any simulation, there's a debrief process and you're able to do some skill building. We were nervous that some of our folks would be really intimidated by that approach. But what we mostly find is people are very grateful that they have that sort of safe practice space before they go out and practice those skills with real people. So I think, you can definitely skill build a lot of those things in that fashion. But I think even going back a step, making sure that validating people's, communication skills, their empathy, at the time of hire is also critically important. I think we've gotten past that point where, we would just say, well, I think the person's going to be okay. I'm not really sure, but I think they're fine. Let's just try it out. And got to a point where we really have to say, okay, I need to ask some real situational based interview questions that are going to simulate the most challenging situation that this person may face. And let's see how they handle it. Because you don't want to get that surprise. There are people that, you can build on their communication skills. And then there's people that it's going to be a forever challenge. And I think you have to be cognizant of that. I think especially in the safety net institutions where a lot of our patients are facing significant barriers, or they don't have the health literacy that other populations do, it actually takes even that much more ability to communicate and be empathic. So you really have to get it right on the front end.
Awesome. Well, Danielle, Chris, Alan, Andrew, River, that is all the time we have for today. But thank you so much for sharing these excellent insights with us. I'd also like to extend a thank you to AMN Healthcare for sponsoring today's webinar. Thank you all for joining us, and we hope you have a wonderful rest of the day.
Thank you.
Thank you.
Thank you.